Okay, so we will continue our last lesson in mental retardation. Okay, so it is a condition of limited ability in which an individual has a low intelligence quotient, mababa ang IQ, usually below 70 on a traditional intelligence test, and has difficulty adapting to everyday life. He or she first exhibited these characteristics during the so-called developmental period by age 18. Okay. It is a developmental disability that first appears in children under the age of 18. Okay. So when we say mental retardation, katulad nga na nakikita niyo dyan sa picture, sabi, it is not a disease. Hindi siya sakit. It is a condition. Because when we say disease, meron itong gamot na parang sipon. Pag uminom ka ng Neosep, after noon, pahinga ka ng konti, gagaling ka. Well, mental retardation is not like that. It's a condition. And this occurs in children below 18 years old. At yun nga, ang sabi dito, kung papasagutin natin siya ng isang traditional IQ test, ang score niya is below 70. Okay. So it is defined as a level of intellectual functioning as measured by standard intelligence tests that is well below average and results in significant limitations in the person's daily living skills. May mga uh, nagsasuffer sa condition na to na mababa or hindi nila maasikaso ang sarili nila na hindi sila nakakapag-perform ng daily living skills. Ano-ano ba yun? Pagkain mag-isa. Siguro naman, yung iba nga, 2 pa lang o kaya 3, kumakain na mag-isa, di ba? Susubo na siya mag-isa. Or, uh, paliligo, pagsuklay. Yan, yung mga uh, basic daily living skills ng isang tao. Pero kung nagsasuffer ka nga for mental retardation, you are not able to do that or limited ang kaya mo lang gawin. Okay, so there are 4 different levels of mental retardation. First, we have mild mental retardation. Approximately at 85% of the mentally retarded population is in the mildly retarded category. Their IQ score ranges from 50 to 70. They often acquire academic skills up to the 6th grade level. So, kaya pa rin naman nilang mag-aral, usually hanggang grade 6. Dahil kapag high school ka na, siyempre, ibang level na yun, di ba? Hindi na kaya ng iba. They can become fairly self-sufficient and in some cases, live independently with community and social support. So, yun yung mga taong may mild retardation lang. Mild mental retardation. Kapag moderate mental retardation naman, about 10% of the mentally retarded population is considered moderately retarded. They have IQ scores ranging from 35 to 55. They can carry out work and self-care tasks with moderate supervision. They typically acquire communication skills in childhood and are able to live and function successfully within the community in such supervised environment as group homes. Kaya rin nilang mamuhay mag-isa. Uh, Kaya din nilang mamuhay within the community in such supervised environments as group homes. Okay. Then next is severe mental retardation. So about 3 to 4 of the mentally retarded population is severely retarded. They have IQ scores of 20 to 40. They may master very basic self-care skills and some communication skills, and they are able to live in a group home. Okay, ayan na. IQ score nila ay 20 to 40 lang. Yung moderate, 35 to 55. And then, Lastly, we have profound mental retardation. Only 1 to 2% of the mentally retarded population is classified as profoundly retarded. They have IQ scores under 20 to 25. They may be able to develop basic self-care and communication skills with appropriate support and training. So, hindi siya natural para sa kanila, yung self-care. Unlike sa atin, marunong tayong magsuklay. Yung iba, hindi ko pala sure. Yung kaya naman maligo mag-isa, yun nga, mag-feed ng sarili niya doon. Their retardation is often caused by an accompanying neurological disorder. They need a high level of structure and supervision. So, yung mga hindi kayang mamuhay mag-isa, kailangan may guardian sila palagi, may kasakasama sila. So, to break it down ng mas madaling maalala, ito siya, ba't tayo lumipat? Yan. Mild mental retardation, 50 to 70 ang IQ. Moderate mental retardation, 35 to 50 or 35 to 55. Severe mental retardation is 20 to 35, and then below 20 or 20 to 25, profound mental retardation. So, bakit nagiging mentally retarded ang isang tao? The main cause is genetic factors naman na about 25 to 30% of cases of mental retardation is caused by hereditary factors. Mental retardation may be caused by an inherited genetic abnormality such as Fragile X syndrome. Ano ba yun? Fragile X syndrome. It is a defect in the chromosome that determines sex, the most common inherited cause of mental retardation. Fragile X syndrome. Ayan, sabi nga sa picture, genetic disorder is the cause of 25% of about 25% of mental disability cases. Okay. Another cause of mental retardation is prenatal illness and issues. So habang nasa tiyan o sinapupunan ng magulang, ng nanay, fetal alcohol syndrome or FAS affects 1 in 3,000 children in Western countries. It is caused by the mother's heavy drinking during the first 12 weeks or the first trimester of pregnancy. Drug abuse and cigarette smoking during pregnancy have also been linked to mental retardation. Maternal infections and such illness as glandular disorders, rubella, toxoplasmosis, and cytomegalovirus infection may cause mental retardation. So, yun na nga, habang pinagbubuntis, nagkasakit ang nanay, ayan, nagkaroon ng infection or addict, nagda-drugs, yoyosi, o kaya umiinom. Yan, yung mga dahilan kung bakit nagkakaroon ng mental retardation ng isang baby. Birth defects can cause physical deformities of head, brain, and central nervous system, frequently cause mental retardation. Another cause and symptom of mental retardation, childhood illness and injuries, hyperthyroidism, whooping cough, chickenpox, measles, and Hib disease, a bacterial infection, may cause retardation if they are not treated adequately. So lahat ng yan, basta nagkasakit ang bata, maaaring maging mentally retarded. Then we have environmental factors. Ignored or neglected infants who are not provided with the mental and physical stimulation required for normal development may suffer irreversible learning impairment. Dahil sa mga, ayan, napabayaan na mga baby, mga hindi talaga naalagaan, it may cause mental retardation. So, Kanina nabanggit natin around 25% ng dahilan ay um, genetics ang responsible. But the remaining 70%, ito yung mga sinasabi diyan na maaaring dahil napabayaan yung bata, ignored or neglected. And mental and physical stimulation ay need din para doon sa tawag dito, alaga. Hindi nabigyan ng tamang patnubay yung bata or yun nga, mental and physical stimulation, walang yumayakap sa kanya, pwede ring maging cause ng mental retardation. Okay. Next is criminal behavior. Familiar na kayo dito. Refers to a behavior which is criminal in nature, a behavior which violates the law. This refers to the conduct of an offender that leads to including the commission of an unlawful act. Basta kapag kahit anong behavior na, yun nga, nakasabi dyan, criminal in nature, na hindi legal ang dating, then that is criminal behavior. According to Golduzian, for human behavior to be considered a crime, three elements are necessary: legally, materially, and spiritually. When we say legally, the criminal act should be prohibited by law. Bawal daw gawin yun. Bawal gawin yung act. Materially, the criminal act should be executed or realized. Kailangan nagawa talaga. And spiritually, the criminal act should be accompanied by criminal intention or guilt. These three elements must be present for an act to be labeled as a crime. Ulit, para daw matawag na krimen ang isang action, una, kailangan labag talaga yun sa batas. Kailangan may batas na nagsasabing bawal yun. Ikalawa, kailangan actual na magawa yung krimen or yung action. Kasi kung naisip lang yan, kung puro kayo plano, kung drawing yung paggawa nyo ng krimen, then it is not considered part of criminal behavior. And then spiritually, kumbaga, papakita kung ano yung intention or guilt nung offender. Okay?